Okay, folks, I appreciate your presence here today. Hey everyone, welcome back to Health Angel Solutions. Today we're going to talk about levothyroxine side effects. We'll cover the whole list of side effects as well as a patient dosing guide. I want to talk to you about all of the side effects, both good and bad, of levothyroxine and how to know if you're on the right dose. This will help patients understand what's going on in their bodies and why they might need more, less, or maybe even need to switch medications. Let's dive right in. First, I'd like to address a few questions you might be asking yourself. We'll go over a lot of these together, but let's start here. First, is levothyroxine helping me? If so, why am I still uncomfortable? Shouldn't I be feeling better if I'm taking medication for my thyroid? If I recently started taking medicine, when will I start feeling better? Are the new symptoms I'm having connected to the medication I take for my thyroid? Another major one is, are these symptoms normal? And why? While taking thyroid medicine, am I still gaining weight? These questions don't make sense. Okay, so if you have ever asked yourself any of these questions, either in your head or otherwise, pay close attention to what follows as we will be discussing each of them. Okay, so let's start by discussing the positive side effects of levothyroxine. We will also discuss the potential negative side effects, but first, let's talk about the positive. To clarify, I want to start here. If you're experiencing a negative side effect from levothyroxine, it's most likely caused by one of two things, which we will discuss in a moment. But what about the positive side effects? Therefore, if you're taking levothyroxine, or any other thyroid medication for that matter, you should be taking it because your body is deficient in that hormone. You may have been diagnosed with hypothyroidism or Hashimoto's disease at some point, and it has been determined that you need more thyroid hormone in your body. Since we're replacing what your body doesn't normally produce, you shouldn't really be experiencing any side effects from the medication itself. That makes intuitive sense, but why do so many patients who are taking levothyroxine feel so awful? Okay, so that's the question we're going to be answering. What I would like to ask you is it usually because of how your body is metabolizing the medication? I'll go into that in detail. Alternatively, it's more likely that something inside the medication, like a binder, filler, or dye, is causing the reaction. Let's start by talking about that. If you look at levothyroxine, for example, this chart, which you can view on the blog post if you'd like, it contains a ton of information. And what it does is that it lists the strength minus 25 mg, 50 mg, 75 mg, 88, etc., as well as the color additives that are present in each of those dosages. As you can see, the 50 microgram dose is likely the best levothyroxine tablet or dosage because it is white and contains no additives or fillers. If you find yourself in a situation where you think you might be reacting to one of these fillers or dyes, that's usually a sign of a hypersensitivity reaction, which I'll discuss further below. However, if you fit that description, it might be easiest for you to just switch to a 50 microgram tablet. Allow me to describe what that might entail. For example, let's say you run 100 micrograms instead of being on the 100 microgram dose right here, which contains yellow number 10 aluminum lake yellow number 6, lots of stuff you don't want in your body. You could take 2 of the 50 microgram tablets, and if you're on 150, you could take 3. Therefore, it's just a matter of basic math, and all you would need to do is ask your doctor, instead of giving me 100, how about giving me 250s? For many, that might be sufficient. If so, it might be a hint or one of the reasons you are experiencing negative side effects from the medication you are taking. You might be experiencing a hypersensitivity reaction to one of those, and the symptoms would be something like hives, which is what your carrier is, or purit is, which is just itching. You might get a rash. You might flush. You might feel warm all over your body. You might also get facial swelling, especially around the lips and eyes. These are the kinds of reactions that are more likely to be caused by something inside the medication itself, not by the hormone levothyroxine. Okay, so I've listed everything that's inside here as well, including the dyes we discussed, and all the other inactive ingredients. Levothyroxine 4 is the active ingredient, but there are a ton of other inactive ingredients as well, which you can view here. Silicon-based cellulose, mannitol, etc. sugar, yada. You can read through all of that on the side if you'd like. But the one I want to draw your attention to is cellulose, and that's what I see a lot of people reacting to, which is why GI symptoms are typically present in conjunction with hypothyroidism, that because of the low thyroid hormone in your intestines, which is similar to consulting on the intestines, lower the amount of stomach acid you have and make digestion a very difficult process. So by giving you cellulose, which is merely a carrier, that is, a sticky plant-based additive, your body may have trouble breaking down the cellulose and, as a result, absorb less thyroid hormone. This is an extreme example, but let's say we give you 50 micrograms. You might only be able to do half of that, or 60%, or 70% of it. That's basically what you could be reacting to because of your incapacity to break down that cellulose. Now let me go over some specific things in detail. First, is levothyroxine making me gain weight? This is a question I get asked a lot from patients, and the answer is possibly, and I'll explain why. I didn't include it in this post, but on the list of side effects for levothyroxine, the guy who gives the medication mentions weight gain as a possible side effect. Okay, he doesn't explain why. However, what I believe may be occurring in many patients is that rather than taking the inactive form of thyroid hormone, T4, and converting it to the active form, a large number of these patients are probably taking T4, turning it directly into reverse T3. This means that they are doing the exact opposite of what their bodies should be doing, taking an inactive reservoir of thyroid hormone and increasing the amount of antithyroid metabolites instead of the free and active form. In other words, by taking more and more T4, you're essentially fanning the flames of cellular resistance to thyroid hormone. As you can imagine, decreasing their metabolism could result in weight gain. As soon as they began taking levothyroxine, they gained 10 to 20 pounds. This is something that I've seen a lot of patients experience. It's not just that 2% of patients take it. I'd estimate that 20 to 40% of patients I see experience this negative side effect. If that's the case, I've included some thyroid conversion charts in here if you're switching medications or how to do that. We'll talk about that a little bit later, but that's something you can definitely think about as well. The next topic I want to discuss is whether levothyroxine is causing my hair to fall out, and that could very well be the case. So you're going to tell me that because I have low thyroid hormone, giving my body more thyroid hormone should potentially cause my hair to grow back. Nonetheless, you might be responding to a filler found in the drug itself. In addition, you might be taking too much of the drug, which could result in further hair loss, or you might be experiencing one of the drug's negative effects. Hair loss is one of the adverse effects of levothyroxine. It's a side effect of the medication itself, so even though you may be taking it in the hopes that it will make your hair grow back, one of the negative side effects is hair loss. If you fall into that category, things can get a little tricky because you'll be wondering if you just need more medication or if you already have too much of it. At that point, the picture becomes a little hazy, but usually switching medications and my experience will resolve the problem. Additionally, I've observed a small number of patients with worsening dietary deficits. When they now receive a supply of thyroid hormone from their body, iron, zinc, and other nutrients are usually involved. So once again, keep in mind that we're not necessarily talking about hair growth today, but these are the things to take into consideration if you have noticed an increase in hair loss as a result of taking levothyroxine. Just know for today that the medication might be the cause of that, okay? So going up may not be the answer, although it could be all right. In such cases, what will typically happen is that you will have no control over your circumstances. By this, I mean that if your doctor is adamant that you must take levothyroxine and is unwilling to change your medication, you should investigate your body's nutrient status with regard to zinc, iron, vitamin A, and selenium. Studies have shown that these micronutrients can be deficient in hypothyroidism. but they are also necessary for healthy hair growth. Since many of you may simply be deficient in these, and that could be aggravating your hair loss, replacing these or replenishing them might be sufficient to stop and halt that hair loss. In fact, even if it just holds the hair loss in place, which is what I would consider a win. I know that most of you really want your hair to grow back, but at least it would be a step in the right direction. The next question that I get asked a lot of patients is this the right amount of levothyroxine for my body? Since they ask themselves, shouldn't I be feeling better when taking this medication? And yes, if you are taking thyroid hormone to replace that deficiency, you should be experiencing these side effects. Okay, so you should be feeling more energized, especially if you're tired. You should also be losing weight because one of the benefits of thyroid hormone and thyroid action in the body is that it improves hair, skin, and nails, elevates mood, regularizes menstruation, lessens joint pain and muscle soreness, and doesn't cause constipation. So why are you still having these symptoms? This is what we're going to address right now. If you're replenishing that deficiency in your body, there could be two possible causes. The first is that you might not be taking the recommended amount for your body. Perhaps your doctor is basing your dosage solely on your TSH levels. Alternatively, there could be a thyroid hormone deficiency. For example, you might only be taking 50 micrograms instead of 150, or you might only be taking 100, and receiving that extra dosage could be sufficient to totally cure your symptoms. However, this isn't always the case, which gets us to our second point. It's possible that the T4 medicine you're taking, levothyroxine, synthroid, tyrosine, etc., isn't the ideal choice for you. I've done a lengthy video on this, but I'd like to go over it again in a more condensed form here. I've divided the various kinds of thyroid medications into these subcategories, and I want to discuss which patients should think about which of these. The first is whether patients should think about using naturally desiccated thyroid, such as Armour Thyroid Nature, Dookie Thyroid, etc. Those who fit into these categories, those who have not felt better on T4 for only medications, are the ones I think should consider using an NDT medication. Those who are 10 to 20 pounds overweight and have mild weight problems are the ones who I think should consider using T3 only medications. After that, who should consider using T4 for only medications? Let's start with the NDT. I have this list that you can go to my side and save to Pinterest or whatever so you can keep track of this image. I find it to be very helpful for a lot of patients. Those who have never taken thyroid medication before, those with low FRET3, low FRET4, and relatively normal reverse T3. We'll discuss those in the next section, but who should really think about using T3 only medications? Those with high reverse T3 levels, those with leptin resistance, those with insulin resistance, those with diabetes and prediabetes, and those who fall into a broad category include those who have abnormally low body temperatures, those who have a personal or family history of mental health disorders, those who have failed T4 medications, and those who haven't taken thyroid medication before. I want to call your attention to these two areas because if you are taking levothyroxine or NDT alone and you are still experiencing symptoms, your TSH has been suppressed, and you have never felt better regardless of your dose, you may fall into one of these categories. If I were you, I would look at these and go through this list and ask myself, well, have I lost 10 or 20 pounds? Check. Yes. Have I felt better on T4? Nope. That's not it. I haven't felt better, okay. What about the location of my low free T3 or T4 levels? You may just browse this tool to see which category you fall into. And if you believe you require T3, you can view your reverse T3 levels. If they are 20 or 30 all right or outrageous, it means your body is starved for T3. Do you have leptin resistance? Insulin resistance? Has someone told you that your blood sugar is high? You can go through this list and sort of cross things off one by one to determine where you think you fall. However, I wouldn't do that if you're not feeling better on the medication. That would be something you should definitely take into consideration if, as I'm going through this list while I'm speaking to you, you realize that all of this is familiar to you. I haven't felt any difference. Regardless of what happens with my dosage, I just keep feeling worse. Therefore, you might definitely fit into one of those groups. The next thing I want to discuss is the potential negative side effects of levothyroxine that you should be aware of. As I mentioned earlier, there are two possible causes for these side effects. The first is the hypersensitivity reaction to the fillers or dyes, which we briefly discussed. Other side effects include facial swelling, itching, angioedema, hives, and more. I get what you're thinking. Well, if I have too much thyroid in my body, that would be the best day of my life, since I believe I've never got enough. However, while it may seem beneficial in theory, there are typically some unfavorable side effects, which we will discuss. However, the second reason you might be experiencing negative side effects from levothyroxine is because you might have too much medication in your body. How can you tell if you're heading toward hyperthyroidism? Don't rely just on your TSH reading. I know a lot of folks whose TSH is suppressed due to taking levothyroxine, or T4 exclusively. Though I've seen this happen before with patients who get a boost of energy when they're switched to medications, and then a month goes by and they start to get worse and worse, and their energy just plummets. However, have you know that out of 100 signs and symptoms of hypothyroidism, those are not hyperthyroid patients, all right? So get that out of your head. What are the side effects of hypo? What might you be experiencing if your dose was too high? Number one would be worsening fatigue, believe it or not. However, you are aware of yourself, which may make things more challenging to find out. I will not go over every single one of these, but these are what I would consider to be the most serious side effects of levothyroxine: chest pain, difficulty swallowing, irregular heartbeat, feeling as though your heart is fluttering or skipping beats. I mentioned this earlier, but some of these side effects can also occur if you're taking 3-only medication, so this isn't limited just to 4-only medication. It could be too much of anything at home to 4 to 3, whatever, okay. I've also included another comprehensive list here. These are all concerning, of course. If you're not peeing as much as you used to, that's a very serious symptom. Other symptoms we've already discussed include nausea, vomiting, fever, and the like. If you'd like, you can read the entire list here. These are some of the less common but less serious side effects of levothyroxine, such as cramping or abdominal pain, decreased appetite, possibly a worsening of depression or anxiety, and warmth. Although not experiencing excessive heat, sudden hair loss, as I previously indicated, there are certain problems with fertility and weight gain there. Moreover, weight loss, these symptoms are more common and may go away depending on how your body metabolizes the medication. The other symptoms I mentioned should prompt you to see your doctor right away. The less serious and more common ones may only be temporary, but if they last longer than 2 to 3 months, I would advise you to at least visit your doctor again for a revaluation to determine whether this is the right medication for you. After all, you shouldn't be feeling miserable if the medication is replacing the deficiency in your body in the first place. There are now better ways to handle it, but as I previously stated, you may be okay in your circumstance if your doctor is unable to work with you. In that case, you may need to take advantage of what resources are available to you. To sum up, I don't want you to leave this thinking that levothyroxine is a horrible drug, even though only 5 to 10% of people actually benefit from it. However, you could be one of those people. In that case, I would advise you to return to this image. You should not think that levothyroxine is bad for everyone, but it isn't good for everyone either. Some people do need NDT or T3, and you'll have to sort of go through this and understand that this is not something to live and die by. Instead, this is a guide that you can use to figure out where you might start or what might be your next transitioning point. Simply plug in your symptoms and see which one you might do better. I really hope you found this to be very useful. If you've been having bad side effects from levothyroxine and you think it could be a hypersensitivity reaction, that could be a sign to maybe switch to the 50 microgram dosage. If you think it could be related to your body's metabolism, you might need to change to a different medication. If you think it could be because you have too much, the simple solution would be to just cut your dose and kind of go from there. Anyway, I really hope that this was helpful to you all. I enjoy creating these things, so please feel free to post your comments, recommendations,